epidemics have significant costs on the economy. And studies have been done on the loss in GDP. And this translates to loss in revenue, an increase in government spending when we have health emergencies like epidemics, pandemics, and so on. Meaning that government deficit will be larger because revenue will decline as spending increase sharply. So the government needs to be keenly interested in the outcome of a meeting like this, so that as a government, health security will be on the front burner, and as a people, for us to make provision, because indeed households are just one major health challenge away from poverty. When a household is hit by a particular health challenge, savings can be depleted before you know it, and many family members may be lost even as a result of that. I want us not to come to the point of defending our various offices. Health issue is a serious issue. So it's not a situation where we say we are prepared. We are doing a lot. The question is, if there is an outbreak now, can we handle it? And what is the likelihood of an outbreak happening? So we need to be able to look at what other countries are doing now to prevent outbreak, which we are not doing. In our various MDAs, especially those from government at the federal and the state level, so that at the end of this meeting, we know specific actions required from the different agencies of government, and also what other stakeholders can do so that we can be prepared. Our major focus is on budgeting for epidemic preparedness. I've seen the plan that was prepared, the NAPHS that was prepared. But I looked through the participants. My colleague from the Ministry of Health or the Center for Disease Control can correct me. But I don't think the Budget Office or the Ministry of Budget and Planning was involved in the preparation of that plan. I looked through the participants. Maybe there is a typographical error, maybe they participated, somebody participated. The commissioners for budget and planning, did they participate? If they didn't participate, that plan, as beautiful as it is dead on arrival. Why did I say so? these are offices that estimate government resource envelope over time. They know the amount of money that will be available in the medium term. And resources are allocated. Federal and state resources are allocated by these offices. So number one, they need to have an understanding of this emergency and the importance of this on government fiscal performance and the urgency of the situation and the elements that needs to be funded, so that you can match this detailed plan that we have with the resources available in the public sector. And so that you can be able to know what the federal government can do. I've seen Federal Ministry of Health, National Center for Nigeria Center for Disease Control. I've seen Federal Ministry of Agri. I've seen. The question is, how much within this time of this plan, 2018 to 2022 or so, how much is even Federal Ministry of Health expecting from government? So you need to have been able to match how much the ministry is expecting and what the ministry is expected to do here, so that you are able to identify resource gap, and so that you can be able now to know how the Ministry of Health, for instance, can finance that gap. Maybe through PPP arrangements. Maybe some of the things here that the Ministry of Health is supposed to, finance are things that you will not have the resources 100% from government to finance. Maybe some aspects of these activities can be private sector driven for effectiveness, effective service delivery, and to be sure that it happens. Even the same Ministry of Agri, Ministry of Environment, and then at sub-national level. Then, critically, to be sure that these laudable activities are even captured in the budgets of these different critical MDAs. We have very detailed plan, costed, with stakeholders. Is the Ministry of Environment looking at this plan when the ministry is preparing its budget? Very soon, the 2020 budget will be prepared. Is the Ministry of Agri looking at this plan? Do they have activities that have been identified as critical activities for the ministry in this plan? Do they have it in their 2020 budget? Do they have it in their 2019 budget? If you say between 2018 and 2022, you expect Minister of Health, Minister of Agri, Minister of Environment to do A, B, C, D, in 2018, was it reflected? Was the money released fully? Or was it not reflected? Or was it reflected and the money was not released fully? How do you track? How do you monitor the implementation? So that's one aspect of this. So we need to know that, so that we are sure that the plan will be effectively implemented. Going forward, it will be good to have very strong, link between the offices that allocate resources. The Minister of Finance does not allocate resources. Resources are allocated by the Minister of Budget and National Planning now. And the Budget Office is an agency of the Minister of Budget and National Planning. You know, the political leadership dictates the general direction of the priority of government, security, infrastructural issues, and so on. You know, then the office gives effect to that priority that is identified. So, that is one aspect. The other aspect that we need to also take note is who is monitoring the implementation of this plan. So, first, we have said we have different stakeholders reflected. But I don't think development partners are reflected, isn't it? And the private sector, they are not reflected. So the expectation is as if all the resources required will be from the public sector, is it? So, but how come that these stakeholders are not in the plan? Yeah, so effective monitoring of the plan. The very first thing will be these activities, are they in the budget? That is the first thing. So if you have a technical working group, for instance, you know, that meets, in that meeting, you'll be able to look at the budget of a particular ministry that is being proposed. And you'll be able to say, you are supposed to do this by so time next year. But this is not in your budget. What is not in the budget cannot happen. Because the budget is a law. Somebody cannot just wake up and then implement a project with government funds. It has to be in the project, the budget. So the monitoring will start with, you know, identifying and making sure that these activities are in the budget of the different MDs. You understand? And then following also with the release of funds as the budget is being implemented. And, you know, whether fully or not fully released, and to know, you know, the status of the implementation of such activities. Very, very important. Now, I mentioned the aspect of the development partners. You see, the International Cooperation Department of the Ministry of Budget and Planning interface with all the different partners. So they know what they are doing, where they are working, and so on like that. So if they have participated, it would have been possible for us to be able to know what each of these different development partners can support in the plan. All right. So the summary of this is that financing these activities for epidemic preparedness is beyond the resources of government. That is the reality. It's beyond the resources that government, you know, how many trillion did we say? Trillion naira. It's more than what government can finance. So, first, we need to understand that point. That the government alone cannot finance these important, activities. We really need to be sure that MDAs budget for these activities. You see, attention is usually focused on the money is not enough, the money is not enough, the money is not enough, the money is not enough. Allocate more resources to health. 26% for which sector? Education, isn't it? Health, 15%. 15 plus 26 is equal to 41 for education and health. Agric, 15%. 41% plus 15%. That gives us 56% for health, education, and agric. You understand? So it cannot work. When you look at the challenge of society now, security is top on the agenda. Infrastructure is top on the agenda. So the fiscal situation is such that we need to, it has been mentioned by somebody, we need to, maximize the use of the resources that we already have in the health sector. The government has shown commitment by increasing allocation to the health sector over time. I have statistics here. Let me not bore you with all the different trends, And new initiatives are being brought to bear, even with the private sector, even new loans from the World Bank to finance health sector activities. But I tell you that there's a lot of money leaking, a lot of revenue leakages in the health sector. So it's important that we're able to plug these leakages by introducing electronic payment systems in the various health institutions. Ordinarily using POS to pay for, tests, for different things that people have to pay for. You will be amazed how much money that each of these different health institutions will mobilize. There's a lot of money people are paying. And some of the activities that we have in the health institutions now are things that through PPP arrangement we can be able to do them. We can, we can outsource some of these activities and be sure that the services are delivered when they are private sector driven. So with that, we'll be able to have a vibrant health sector. When government sees improvement in the management of resources in the health sector, government will be motivated to allocate more resources to that sector. How do you, allocate more resources to a sector that in pre-colonial times had a vaccine production facility? And decades after independence, we find it difficult to revitalize that facility. We import vaccines now. But before independence, Nigeria used to produce vaccines. I understand during Ebola or during monkeypox, samples were taken to Sierra Leone, if I'm correct. Because we don't have the lab to do the test now. I don't know whether now we now have that lab facility. So it's important as stakeholders like this that you do, an alternative budget for the Federal Ministry of Health, for instance, estimate, you can use their previous allocation. How do you want them to allocate this resource? If you are the Minister of Health, do a budget for them. During their medium-term sector strategy session, present this your alternative budget. If you allocate more resources to prevention, you won't need the curative. If you emphasize wash, you prevent the diseases. It's pretty straightforward. So I think we are very important people in this arrangement, and the budget office will want us to, understand the critical importance of our role, to ensure that MDAs actually budget for these activities that are in the plan, and to track them, to monitor the implementation, and to ensure that the indicators are improving. Because it's one thing to deploy resources. It's another thing for the health sector indicators to be improving. So we have critical roles to play to be able to ensure that, we are prepared to prevent and to control epidemics in Nigeria. Thank you very much.